Good morning. It's Sunday, April 28th. Thank you for joining us for News 8 this week. We've been talking a lot about the race for Iowa's 1st District. Last week, you heard from Republican David Pouch, who is challenging fellow Republican Congresswoman Marianette Miller-Meeks for the seat. Before that, you heard from Democrat Christina Bohannon, who will take on the eventual GOP nominee. This week, our conversation with Congresswoman Miller-Meeks. She's running for her 3rd term. In 2022, she beat out Bohannon by a nearly 7-point margin. We, of course, asked her what she would focus on if reelected, and we asked her to respond to criticism from her opponents. And joining us now is Congresswoman Marianette Miller-Meeks. Congresswoman, thank you so much for taking the time to chat with us this week.
My pleasure, John. It's great to be with you.
You know, I certainly want to talk and look forward to a lot of things here, but my first question is really just about you reflecting on the past couple of years. Can you talk a little bit about how it's gone for you and perhaps some of the things you're most proud of accomplishing?
Well, first, let me just say that I'm now in my 4th year in Congress, 2nd term, and I've been part of some of the most history-making years that one could hope to be in Congress. So I'm hoping going forward we move into boring Congress where we actually do more legislating and a little bit less drama and history making. But we've had some tremendous successes, I think, throughout this time in Congress. One is something I've been working on and promised to work on when I was first elected, and that's prescription drug prices. So our bill, Sharing the Savings with Seniors Act, and then also the Drug Act, both are bills, plus I'm on other bills, trying to lower the cost of prescription drugs. So we're really working hard, and I think these can be very effective in allowing us to have a robust pharmaceutical industry that can develop new cures, such as ones for Alzheimer's and also rare and orphan diseases, but also have the effect, which is tremendously important, of lowering prescription drug prices for people at the counter, both whether you're on Medicare, Medicaid, or private insurance. I've worked very hard to help protect and get access to health care for our veterans. As you know, I'm a 24-year military veteran, so this is a community that is especially personal to me and a priority for me. So whether it is passing legislation such as the Sergeant Ketchum or the Brandon Act, which are looking towards PTSD, suicide prevention, rural healthcare for PTSD, substance use disorder, and also in breakthrough therapies throughout the VA. So we have emerging breakthrough therapies that we've had hearings on and pushing the VA on this stead. And then also on the VA to study and research medical cannabis, because I have a lot of veterans who come to me who are using it on the non-VA side. So this is a research study to be done at the VA. So we'll continue to work on both access to care, rural health care, both for veterans, and then also for individuals. We worked hard on trying to address the workforce issues that we have in healthcare on the provider side, as well as physician provider, as well as nurses, radiology technicians, you name it, all throughout the healthcare spectrum. So those are just a small number of things, in addition to which our community funding projects alone in the fiscal year 2024 budgets that just passed brought about a little over $28 million, much needed for wastewater management, sewer separation, roads, the North Scott Independent School District to help young people to develop careers in industrial and vocational tech, to know that you can do things with your hands and have good paying, satisfying career jobs without going to a 4-year education. So been very proud to be able to support those projects and to help get funding for very worthwhile and necessary projects within our district. Also, the last thing is oral contraception over the counter. This is something that I had passed in the state Senate when I was a state senator. And it's sometimes I forget about it because we're still working on trying to get that across the finish line. But we've really been able to move that ball forward, and we'll continue to push that to get it across the finish line.
What other issues are you hearing from your constituents when you are knocking on doors, when you're taking phone calls? What are some of the other concerns that are going to perhaps, if you're reelected, drive you and drive your direction?
Well, thank you for the question. And by far and away, when I'm out and about in the district, People are very concerned about the economy. They're very concerned about high prices that they're paying. Whether you're a municipality, you're a private citizen, you're a senior citizen on fixed income, you're a working family, or you're a business, everybody is concerned about the high prices that they're paying. There are, some headwinds going into next year. So everyone is concerned about the economy, high interest rates, and then the cost of things that they're paying. So they just don't feel like they're getting ahead or they're doing well. And businesses are concerned about going into next year and what the economic outlook and forecast is. And a lot of that is related to, we know, high spending in the first 2 years of the Biden administration. The second thing I hear about, and this is across all demographics and it is across all parties, and that's the border and the border crisis. With that is related the number of people coming across the terrorist watch list when we have foreign conflicts abroad, and then the amount of fentanyl. So when you're talking to law enforcement, when you're talking to individuals, and I've done work in this space for substance use disorder. We just, as you know, Vera French just had its ribbon cutting. And so this is, we've been working very hard on this issue, but we have just record amounts of fentanyl, synthetic fentanyl, and other drugs coming across our border. And this is wrecking havoc on our communities with, record numbers of overdoses within all of our communities, different drugs in different communities. But it's certainly a challenge both for our law enforcement, our healthcare, our mental health, and substance use disorder communities. And those families who have people that are, suffering under the addiction of drugs.